Welcome to the Loving Support WIC Peer Counseling Training Program for WIC managers, coordinators, and supervisors. This training has been developed through a cooperative agreement between the USDA Food and Nutrition Service and Every Mother, Inc. It is designed to help state and local WIC agencies implement and sustain successful peer counseling programs that help participants in the Special Supplemental Nutrition Program for women, infants, and children receive the help they need to reach their breastfeeding goals. The training program for WIC Peer Counseling Program Managers, Coordinators, and Supervisors provides program guidance based on the FNS Loving Support Model, research on the evidence behind peer counseling, best practices adopted by state and local WIC agencies across the country, and solutions to address common challenges. State and local agency showcases are also included to highlight successful strategies. The curriculum is divided into 10 major sections. Each section is important for training new managers and for staff in existing programs to assure continued best practices in program management. Each section has an accompanying notebook and handouts. Feedback from participants during in-person training indicated the notebook was an extremely valuable resource. Both the notebook and handouts are accessible on the Maryland WIC SharePoint website. Please print each notebook section and the handouts prior to viewing the webinars so that you can follow along, take notes, and reference handouts as they are discussed. Welcome to Section 4, Policies and Operations. Once state-level decisions are made about the program and state agency policies have been developed, local agencies should be supported in implementing a program that will meet the specific needs identified in their communities. This section provides options and best practices for implementing a peer counseling program at the local level. At the end of this webinar, WIC managers will be able to identify at least 3 factors integral to the development of a breastfeeding peer counseling program in WIC, identify local level policies that can support peer counselors in their job. You will need to have the handouts entitled Maryland WIC Local Agency Breastfeeding Peer Counselor Coordinator and Assessment and Planning 8, Solutions to Common Challenges with Peer Counseling Programs available for reference. Local agencies must implement a peer counseling program that aligns with the FNS Loving Support Model, which outlines best practices for managing effective peer counseling programs. State and local agencies should periodically examine program policies, practices, and feedback from staff and participants to consider improvements. This might include strategies to expand the program, promote it within the community, and establish partnerships. The Loving Support Model states a peer counseling program must have designated breastfeeding peer counseling program managers and/or coordinators at state and local level. While state WIC programs provide a dedicated position for managing the peer counseling program at the state level, most programs are administered at the local level by the peer counselor coordinator. This person may also be local agency breastfeeding coordinator, a nutritionist with lactation education or training, or a lactation consultant. The key is allocating dedicated time to manage the program. We briefly mentioned the nutrition service standards in the last webinar, Program Logistics. Let's take a detailed look at the NSS qualifications for local agency peer counselor coordinators or supervisors. They must meet the qualifications for a CPA, have experience in program management, have at minimum 1 year of experience in counseling breastfeeding women, have successfully completed specialized training in lactation management and care. An international board-certified lactation consultant, or IBCLC, is preferred, but individuals may have successfully completed other state-approved specialized lactation training. Please refer to our local peer counselor coordinator job description as we discuss specific job duties. The peer counselor program manager contributes to the development of program goals and objectives for the local agency peer counseling program. They conduct a needs assessment to identify gaps in breastfeeding resources and services within the local agency and community that the WIC peer counseling program can address. And they share FNS provided information to other local agency staff. They oversee training of peer counselors and peer counselor supervisors. They oversee the planning, management, implementation, and evaluation of local agency peer counseling activities. And they keep current with up-to-date breastfeeding information. They mentor new peer counselors, providing routine follow-up and guidance in the early days of the job. They provide ongoing supervision and feedback for peer counselors, including biannual reviews, and hold monthly meetings with peer counselors. They report on peer counseling program activities to supervisors and the state agency and attend all required meetings. The peer counselor program manager coordinates with local community stakeholders, such as hospitals and healthcare providers, to enhance the effectiveness of the peer counseling program. This includes ensuring compliance with rules and regulations of the peer counseling program with collaborating programs. Local agency support and buy-in is critical to the success of a peer counseling program. Support has been linked to lower turnover rates among peer counselors. It creates a climate where peer counselors feel valued as members of the overall WIC healthcare team. Research shows that WIC clients are discouraged about breastfeeding when they receive contradictory information. When all clinic staff share the same information about breastfeeding, it builds confidence in the message and self-efficacy in our participants. Support is more than agreeing to provide a program. It requires intention with implementation. This includes staff trained in breastfeeding management, local clinics that are breastfeeding friendly, and local agency staff that welcome peer counselors as part of the WIC team. How can local managers gain local agency staff buy-in? People are often more likely to support what they help create. Involving local agency leadership and staff in planning and executing the program is more likely to increase support. Discuss with staff how peer counseling makes a difference in helping WIC participants reach their breastfeeding goals. See webinar number 2 for research and data to share. Discuss how peer counselors complement WIC services and save staff time. And discuss the roles of all WIC staff in assuring program success. WIC is a breastfeeding support program, and supporting breastfeeding is every staff person's responsibility. A peer counselor program orientation helps all clinic staff understand the importance of peer counseling and their role in supporting the program. The PowerPoint presentation entitled Peer Counseling, Making a Difference for WIC Families can be used for this orientation. This PowerPoint was discussed in webinar 3. The State Breastfeeding Peer Counselor Program Coordinator is available for assistance with this presentation. The orientation can help minimize misunderstandings and build enthusiasm. It also outlines the roles of WIC staff in ensuring program success, including making timely referrals of WIC mothers who have questions and concerns about breastfeeding, seeking ways to integrate peer counseling fully into WIC clinic flow, promoting the role of peer counselors with WIC mothers so they understand that they are part of the WIC team, and providing support to peer counselors. Local WIC clinic staff should continue to give accurate and positive information about breastfeeding. Every staff member has a role in providing valuable support to breastfeeding women in WIC. All Maryland WIC staff receive basic breastfeeding training and new employee orientation. Staff receive breastfeeding information and education in WIC-WISE 1, WIC-WISE 2, and for 2 full days in Grow and Glow 1 and 2. Encourage staff to use this basic knowledge to support their participants. When staff feel they are encountering a high-risk problem that falls outside of their training, they can refer to the designated breastfeeding expert in their agency. Local agency staff are trained to give breastfeeding counseling, so it should not be delegated exclusively to peer counselors. WIC clinic staff counseling and peer counseling are different. Rather than replacing the work of the WIC clinic staff, peer counselors complement staff counseling by building a relationship with mothers and digging more deeply into the barriers and issues that might make it more difficult for women to breastfeed. Peer counselor contacts are more frequent than certification appointments, and they are not necessarily constrained by clinic schedules. These factors contribute to an increased amount of counseling time by the peer. Peer counselors reinforce the information given by clinic staff to help mothers retain that information and gain confidence that they can breastfeed. Peer counselors have a more limited scope of practice as a paraprofessional. This complementary counseling enables them to operate within their scope and contribute in their unique role as part of the WIC circle of care. The orientation provides a venue for staff to share their concerns regarding paraprofessional staff and provides local agency management the opportunity to address these concerns. Earlier research with WIC programs found that some staff are concerned about hiring peer counselors who are not professionals. The intent of a peer counseling program is to provide peer counselors from within the target population served by WIC. Some WIC peer counselors may not have work experience. They may have issues with transportation and childcare, financial constraints, lack of job experience and job skills, or even job loss. If this is their first job, some new peer counselors may need to learn basic job skills. By modeling professionalism, staff can help guide peer counselors in building their skills. Inform local agency staff that the peer counselor supervisor will work with all peer counselors to guide and build professional development. A peer counselor may work hours that fall outside of the normal clinic hours to meet the needs of the breastfeeding mother. She may work only during the busiest hours. This can be viewed negatively by staff who feel stuck in the clinic all day. Help staff understand that although it seems peer counselors come and go, their job of taking or returning calls from new mothers after hours can be quite challenging too. Offering staff the opportunity to shadow a peer counselor for a couple of hours will help them to better learn what her work entails. Let staff know that peer counselors will be fully trained using the FNS Loving Support curriculum. Our training includes basic counseling skills, basic breastfeeding technique and management, working as part of the WIC team, and how to make appropriate referrals. Remember, breastfeeding promotion and support is the job of every Maryland WIC staff person. Staff receive breastfeeding training through new employee orientation so that consistent messages will be given to new mothers and appropriate and timely referrals will be made. Successful local agency peer counseling programs integrate peer counseling as part of the local agency's WIC program services. This integration does not just happen on its own. It involves careful collaboration between agency clinic leadership and staff to determine best approaches to assure that the needs of WIC mothers will be addressed through timely peer counseling support. Here are some ideas for that integration. Clinics might schedule pregnant and breastfeeding appointments on certain days so that peer counselors with limited hours can be on site for visits with new mothers. Clinic flow can be examined so that peer counselors routinely see pregnant women before or after they see the WIC certifier as part of the standard clinic flow. For initial certification, some clinics have the peer counselor meet the WIC participant during the lengthy clinic visit and then conduct follow-up by telephone or text. For postpartum recertification visits, some clinics schedule mothers to see the peer counselor before the certifier assigns the food package. Mothers calling for food package changes to get formula can be referred to a peer counselor for targeted breastfeeding education and problem solving. New mothers might be scheduled to see the peer counselor as part of routine 1-week or 2-week checkups or weight checks. Some clinics appoint pregnant and postpartum women to group education experiences for second nutrition education contacts. This can include both prenatal nutrition or breastfeeding classes, as well as postpartum support group meetings. Peer counselors often assist with planning and teaching the breastfeeding portion of these classes. Some of our local agencies have relationships with local hospitals to receive names of WIC moms delivering each day or each week. These lists can be shared with peer counselors so that they can provide immediate follow-up support. The loving support model states support of peer counselors includes their participation in clinic staff meetings and breastfeeding in-services as part of the WIC team. Local agencies should include WIC peer counselors in clinic staff meetings as part of the WIC team. This helps validate the important role of the peer counselors and helps build relationships with staff. Breastfeeding coordinators and peer counselor coordinators can work together to encourage and support peer counselors in presenting brief breastfeeding presentations as a part of staff meetings. This will build the confidence of the peer counselor and of the staff in the peer counseling program. In addition to formal clinic integration policies for peer counselors, informal referral systems should also be explored both within the WIC clinic setting and within the community. Peer counselors depend on referrals from local clinic staff to provide timely and appropriate follow-up for pregnant and postpartum WIC participants. Some of our local agencies use WOW reports to generate call lists and clinic visit lists for peer counselors. In other agencies, peer counselors receive referrals through staff referral paper forms, telephone, or email messages. Whichever procedure your agency uses, orient all staff to the protocol for referrals. This will ensure no pregnant or breastfeeding woman is left out of the value of the peer counseling program. A referral program in the community enhances program success. A seamless network with the local hospital will allow breastfeeding mothers to be followed immediately after hospital discharge. A referral stream can also be identified with local providers who see pregnant and breastfeeding WIC mothers, along with home visiting programs and community organizations such as infants and toddlers and early Head Start programs. The loving support model states peer counselors must have timely access to a WIC designated breastfeeding expert for assistance with problems outside of peer counselor scope of practice. Peer counselors operate under a narrow scope of practice that focuses on basic breastfeeding information and support for normal breastfeeding. It is important to emphasize with all clinic staff that peer counselors should never be asked to handle complex breastfeeding situations that require follow-up from a health professional skilled in lactation management. Section 6, Scope of Practice, gives more details about the peer counselor scope of practice and options for helping them operate within those parameters. Each WIC clinic must establish a WIC-designated breastfeeding expert to accept referrals of mothers experiencing complex issues beyond the scope of the peer counselor. The Nutrition Service Standards list the qualifications for the DBE position. Some agencies hire IBCLCs and other lactation experts as salaried employees or contractors to handle referrals of mothers experiencing problems. Some agencies partner with the local hospital lactation expert to be available for follow-up. Some agencies grow their own IBCLCs. State breastfeeding unit staff are available for assistance with this process. Clinics support peer counselors when they create a breastfeeding-friendly environment that welcomes WIC mothers and encourages breastfeeding. Periodically examine your clinic environment to be sure that mothers receive positive messages about the importance of breastfeeding. A positive breastfeeding clinic environment not only demonstrates to mothers the importance WIC places on breastfeeding, but also fosters and enhances staff efforts in promoting breastfeeding. Local agency peer counseling policies must align with the FNS Loving Support Model and relevant state policies. Local agency program managers should meet with stakeholders, decision makers, and staff to identify solutions for bringing the program into alignment with the evidence-based standards outlined in the model. Other best practices have been identified to help improve program operations and assist in retaining peer counselors. Local agency program managers should explore these policies to determine if they are feasible. Refer to the handout Assessment and Planning 8, Solutions to Common Challenges with Peer Counseling Programs, for possible solutions to some of the questions that might arise as policies and practices are reviewed. The State Peer Counselor Program Coordinator is available for assistance with finding solutions for your local agency. The Loving Support Model states peer counselors should be available to WIC clients outside usual clinic hours and outside the WIC clinic environment. Research shows that being accessible whenever mothers have questions or concerns facilitates quick help and support when moms need it most. Breastfeeding problems do not happen only when the WIC clinic is open. Strategies to facilitate access to WIC participants beyond the WIC clinic environment and usual work hours include allowing peer counselors to work at least a portion of their allotted hours from home so they can be available evenings and weekends when mothers have questions or are experiencing challenges, and enabling a peer counselor to make hospital visits with moms in the early hours when breastfeeding is being established. Many agencies will allow peer counselors to make phone calls or send text messages from home. Peer counselors' time is recorded and supervisors conduct spot checks to monitor. Working from home helps peer counselors minimize child care costs and helps them continue their own breastfeeding journeys. This flexibility helps improve peer counselor retention. Some agencies establish an on-call rotation so that only one peer counselor fields calls from mothers after hours. These agencies use a designated cell phone to rotate between the peer counselors. This increases safety for the peer counselor because participants do not have access to the peer counselor's home number. The State Breastfeeding Peer Counselor Program Coordinator has sample cell phone policies to share with local agencies who provide cell phones to their peer counselors. Some agencies have difficulty obtaining buy-in for telework options from county or agency directors. The State Breastfeeding Peer Counselor Program Coordinator is available to assist in preparing a plan to identify barriers. Some of these options include presenting the Loving Support Model guidelines and rationale. Often, policymakers are not aware of the unique needs of the peer counseling program and why being available to participants is central to the program effectiveness. developing a plan for documenting peer counselor contacts outside the WIC clinic environment with a strong supervision component. Including a plan for regular spot checks increases confidence in this plan. Sharing practices employed in other local agencies, such as allowing peer counselors to rotate being on call, and providing a cell phone for that purpose. Another option is to provide a clinic warm line that is staffed by peer counselors who rotate this service. Collaboration with other agencies could also be considered. Policy 5.13b is our confidentiality agreement. Peer counselors are asked to sign this during breastfeeding peer counselor training and take that signed document back to their local peer counselor coordinator. This should be reviewed during each peer counselor's annual evaluation. Signing the confidentiality agreement reinforces to peer counselors the importance of not sharing a mother's personal information. Peer counselors are trained on the importance of confidentiality. This should be reinforced at every staff meeting. For peer counselors working in settings outside the WIC clinic setting, efforts should be taken to assure protection of the peer counselor's documentation materials. For example, through a locked briefcase or file box, or enabling peers to document in the WOW system via laptop. The loving support model states adequate program support includes establishment of community partnerships to enhance the effectiveness of a WIC peer counseling program. WIC mothers have the best chance of overcoming barriers to breastfeeding when there is widespread community support. One of the primary complaints voiced by new moms is lack of consistent information surrounding breastfeeding. When a mother receives consistent, evidence-based information from all providers, she is better able to meet her goals. Having peer counselors make contacts with participants in the hospital reinforces education and information discussed during prenatal contacts. A mother's early experiences with breastfeeding in the first hours and days of life are significantly associated with an infant's later feeding. The 2016 breastfeeding report card from CDC shows that 20.5% of breastfeeding newborns in Maryland are supplemented with formula within the first 2 days of life. Rates of exclusive breastfeeding continue to rapidly decline in the early weeks. More than 80% of women initiate breastfeeding, but only 60% of breastfeeding mothers are still breastfeeding exclusively by 7 days postpartum. A referral program with the hospital helps establish seamless follow-up care from hospital to home to improve breastfeeding exclusivity and duration rates for our participants. The Baby-Friendly Hospital Initiative, Step 10, requires hospitals to establish referral networks for women upon discharge. This provides WIC agencies with an ideal opportunity to begin conversations with hospitals to collaborate in helping them meet this step. The MOU set up between the hospital and the local agency should outline the training and scope of practice for the peer counselors. Private healthcare clinics and providers can make referrals to the peer counselors and the breastfeeding support services in the local WIC clinic. This assures that mothers receive timely help with difficulties. Outreach to local healthcare providers provides information about your agency's peer counseling program. Explain the peer counselor scope of practice and the ways they complement the healthcare team by supporting mothers with breastfeeding. Share that peer counselors have access to designated breastfeeding experts for complex breastfeeding situations that fall outside their scope. Peer counselor training addresses how to handle misinformation peer counselors believe a mother may have received from sources outside of WIC. Breastfeeding peer counselor coordinators and peer counselors who attend state and local breastfeeding task forces, coalitions, and lactation consultant chapters have the opportunity to promote the program to healthcare providers, mothers, and other organizations in the community. La Leche League is an international mother-to-mother support program. They developed the original concept of applying peer counseling to breastfeeding. La Leche League has support groups in many communities throughout the country. La Leche League leaders are important links to the community by providing referrals of mothers needing assistance to WIC. Mothers who do not meet WIC's eligibility requirements can be referred to these groups for help and support. Community organizations that reach the same target population served by WIC are ideal partners. Consider outreach to establish partnerships for referrals to WIC peer counselors, to host breastfeeding education activities, and to provide consistent messaging. These programs include, but are not limited to, the Judy Centers, the Healthy Start Program, the Early Head Start Program, county extension programs and expanded food and nutrition education programs, minority health organizations, teen pregnancy centers, parenting groups, and child care providers are all potential community partners. Make plans to actively promote the program with WIC participants and the community. For WIC participants, inform all newly certified pregnant and breastfeeding mothers about the program so they are aware they will be contacted by a peer counselor. Help new mothers see that peer counseling is part of WIC support for breastfeeding. Allow peer counselors to visit with new mothers in the clinic so they can meet face-to-face. This helps mothers see peer counselors as part of the WIC team. Post flyers about the program in the WIC clinic to raise awareness about the program. For the community, publicize the program with other public health programs in the health department and with programs that serve similar population groups. Let people see how peer counseling will build upon existing successful breastfeeding promotion and mother-to-mother support programs in the community. A WIC peer counselor says, "We have a really good relationship with the lactation consultants here at the local hospital. It is wonderful to have this kind of relationship. We are all striving for the same thing, and that's to help moms." This concludes Section 4, Policies and Operations. Please continue on to Section 5, Staffing Considerations.